Thanks for joining. This is Live with Miami's Community News, and our guest today is Dr. Adriana Bonansea Frances. Did I get it right?
Yes, you did it right.
And
Great.
you're an MD and a PhD.
Yes, I
So,
am.
folks, she's pretty smart. All right. You're with the Florida Center for Allergy and Asthma Care.
Yes.
Right? And there are 19 offices. That's throughout Dade, Broward, a little bit in Palm Beach.
Yes, exactly.
There's a lot of doctors are working there nowadays.
Yes, we are a big group.
Yeah.
Yes.
So today we're going to be talking about asthma.
Yes.
And the reality part and the misperceptions.
Yes.
When we were growing up, don't worry, it's childhood asthma and it's going to go away as you grow up. What's the real story about asthma and what are the effects that it can have on a person and on their family for people that are not familiar with it?
The thing is, asthma is a chronic condition. And in childhood is the most important chronic condition. Chronic means that it has a long time from the start to really the end, that there is no end, there is no cure for asthma. But there are different types. At some point we were talking about asthma like one disease. Now we know there are different subtypes of asthma. So the word asthma is an umbrella that covers all of those.
When was it discovered that there were multiple types of asthma, more or less?
I think in the past, like should say 20 to 30 years, when we started to look at the immune system in a different way, we started to see that there was allergic asthma, non-allergic asthma. Then we started to look at the genetic, and there was different, what is called genotypes, different types of genes involved in different types of asthma. And when we started to look also at the environment, so there are many components. You have the genetics of the individual, you have the reactivity of the individual, and you have the environment. So there are different things.
So what are some of the symptoms that a non-clinician could see from somebody that's suffering from an asthma? I'll use the word attack, if you will.
This is the thing. The asthma affects the bronchi. The bronchs are like the pipe of your house that instead of getting water to all the areas of the house, delivers air to your body. So these pipes has something that is called muscle that contracts and relaxes. When people have asthma, you have inflammation, and inflammation produces swelling of these pipes that you have, and you have constriction. This constriction is going to give you different symptoms. The number one symptom that everybody knows about is the wheezing. It's a wheezing sound that because you have mucus plug, the air is able to go in, but when it's going out, it's wheezing because it's not able to go out the proper way. So number one is that one.
So these symptoms are lots of problems, allergies, COVID perhaps, all right?
Well, this is the thing. Some people have allergies, especially in young children and young adults. And some people don't have allergies. It's just what is called intrinsic asthma that is produced because of different situations. What happens is that in children, it's very common that they start with a viral infection. COVID is a virus, so COVID can make you worse. It's not that it's going to produce asthma, but it's going to make your asthma worse. But there are some viruses, especially in children, when they start going to daycare, that is called rhinoviruses. And those are the main component in many kids for their asthma because they produce inflammation of these bronchi, and then you start cough, wheezing, shortness of breath. In kids, the most common symptoms besides the wheezing is the cough. Some kids, the only thing that they have is cough, and they cough during the day, but mostly they cough during the night.
So when you look at people that are having distressed breathing, all right?
Yeah.
I've heard people, oh, it's just asthma. Don't worry. But we should be concerned about people when they're having asthma. So is there a literal asthma attack, or is it just phases of it that get worse?
No, there is both. you have, as we say at the beginning, it's a chronic condition. So the inflammation is there. If on top of this baseline inflammation, you have something else, exposure to allergens, exposure to some chemicals in the air, to dust and all that, or you have a viral infection, this inflammation gets worse. And at that point, you have an asthma attack.
So when people go and they go out into a plant nursery and there are all sorts of pollen floating around and maybe there's insecticides all over the place, can that trigger?
Yes.
All right. And so is that an allergic reaction that's causing asthma, or is it, what would you call it when they get that?
Well, there is a mixture. People that have asthma has increased reactivity in their bronchi. So cold temperatures, going from, one place that is very hot to a place that is very cold, trigger that. Exercise can trigger that. And if you have an allergic component, especially in children and young adults, anything that you are allergic to, dust, pollens, or anything like that, animal dander, will trigger the asthma attack.
So when somebody starts coughing suddenly, all right, and it doesn't seem like there's a cold, that could be either
yes,
it
can be asthma or can be an infection like a viral infection, but usually a viral infection, you have something else. You have a runny nose, you have a little bit of fever, you have malaise, something like that. But asthma can start with a runny nose if you have allergies, but it's mainly going to be the cough, the wheezing, and the shortness of breath.
So how often do patients come see you and they've self-diagnosed and they go, hey, I have whatever it is, rather than the symptoms?
Many times. Many times people know that they have asthma and they come and say, I have asthma and this is going on. And sometimes they think they have asthma and they don't, because there are some other conditions that can be similar to asthma without being asthma.
Probably 30 years ago, we wouldn't see many drug ads on TV. Now there's a pill for everything. And usually, you see this, the inhalant, don't take this for regular usage. So tell us about when people have self-diagnosed and they see that on the TV and they go buy the widget over at the store, they start using it.
Well, the main thing is most of the medication for asthma are not over the counter. You have to have a prescription for that. But some people have, or my grandfather has this, or my aunt have this, and they use whatever they have around before being seen. The most common one is what is called Albiro, that is an acute bronchodilator. So it works fast, but the action is short.
How fast does it work?
10 minutes, maybe 15 minutes.
Mm-hmm.
And this medication is only for the acute exacerbation, the acute attack, because it doesn't go into the inflammation. It just opens up the airway so you can breathe temporarily, usually lasting 4, 6, 8 hours. And then the effect disappears and you go back to the same symptoms that you have.
So what percentage of people would you say that have asthma are actually seeing a clinician for that?
I don't know exactly. I can tell you this. There are 25 million people that have asthma in the States.
Wow.
So 1 in 13 people have asthma or has had asthma at some point in life. So it's a huge percentage of people, okay? But some people had that during childhood. They got better during the adulthood, and they continue using medication according to what they were told at the very beginning. So sometimes, unless they have to go to the hospital, they don't do a consultation.
So when their doctor says you should go have a breathing test, is that to look for lung capacity, or is that what other?
Well, this is the thing. You have the bronchi, that's a structure, and you have the lungs. The lungs is surrounding the bronchi. When you look let's say, to an X-ray, you're going to see the structure. When you need to see how the function is, how the volume, how much you're able to get in and out, you need what is called spirometry or pulmonary function test. And when we see people with asthma, we always do that because that's the right measure that we have to see if it's improving or getting worse.
When somebody does that test, you can tell the what percentage capacity they have
Yes.
of the total volume that they could have.
Yes. And what happens is that you have a baseline, and then many times we give this Albiro, that is the acute bronchodilator, to see how much reversibility you have. And that's one of the conditions to say that you have asthma and not COPD or emphysema, because you have what is called reversibility, means that you have inflammation and you can treat that and you can get better.
So, Dr. Frances, how would you explain to somebody that is unaware of asthma and what it can do to somebody that is having an asthma attack? How would you explain it?
Okay. Main thing, you have to know your breathing. You have to know your capacity. The main thing is many times the exercise. If you are sitting like we are sitting here today and talking, and usually just talking, nothing is going to happen, even if you have a lot of inflammation. But if you start going up the stairs, or a child goes out and, at school they have to run the mile, all of a sudden they realize that they cannot finish that they have to stop because they cannot breathe, or they start coughing, or they start hearing the wheezing. So you have to know what is triggering you. Let's say you start at night, you wake up in the middle of the night because you cannot breathe or you are coughing. So the first thing that you have to do is that, when do you have the symptoms? Are these all day long? Are these at night? Are these some time of the year when the pollen count is high? Is this when you are exercising? And then what we do in the office is we give the albuterol and make them feel how they feel after the albuterol, because some people don't realize when they have symptoms. All of a sudden they crash.
Because you sort of get used to it.
Yes, because human being, we get used to everything. So you get used to breathe less and you don't realize when you're having problems. So one of the pulmonary function test does is you breathe and you have a hard time breathing, you get the albuterol and all of a sudden you can breathe better.
I would say this is the way it's supposed to be.
Yes.
So the way you've been going through it
yes,
is not normal.
exactly. And then depending on your capacity, depending on how long you have been with symptoms and how severe are the symptoms, you start with the proper treatment to decrease the inflammation. And then you have different types of medications that can treat that inflammation.
So asthma and allergies, these are all connected to one another.
Most of the time, yes, but there is a group of people that have asthma and allergies,
Yes.
and there is a group of people that have only asthma not related to allergies.
Prior to COVID, people say, oh, your nose is running. Oh, it's just allergies, right? So when is that going to, I'm going to take COVID out of our experience, right? So when you'd see people, how do they know the difference between an allergy and a cold, right?
It's not that easy sometimes because the symptom can be similar, but in general, when you change, as I say, from hot to cold, or you are outside and start sneezing and having a runny nose and your eyes are watery and you start, crying in the middle of, the park, most of the time that is going to be allergies.
And after a while, you deduce
Yes.
what that's from. So my father had a stroke many, many years ago, and we had to give him some medicine to calm him down, just so that he could function.
Yes.
After a while, he figured out that we were putting it in his drink.
Yes.
And then he stopped drinking it.
Yes.
And it's like, oh, darn, we got to figure out some other way. He just thinking, no. And he figured it out. So with the allergies, if you have these kind of symptoms, and then maybe you go to a different place, and then they go away,
Yes.
you go, okay. And then you could start having that deduction. So most allergy medicine is available over the counter. So we're constantly self-diagnosing.
Yes.
It's only this, and then a month later we're saying, oh, you need to go to the doctor.
Well, when you try 1, 2, 3 different antihistamines, those are for allergies, and all of a sudden you continue having the same thing, symptoms. At one point you say, well, I'm tired of being tired because allergy make you tired. You cannot breathe properly. You don't sleep properly. And all of a sudden you say, okay, I have to do something about that.
So let's talk about food allergies and how that affects your breathing, and to be able to see the difference. So I'm trying to understand it. You could have allergies. I mean, you could have asthma by itself. You could have allergies that can cause an asthma attack.
Yes.
Right. So I know last time we spoke about a year or so ago about allergies, and the big
food
one
allergies.
Yes, food allergies. Right.
Yeah.
And there's obviously this big question about peanuts. Not a question. People are allergic to peanuts. What percentage, more or less, of people are allergic to peanuts?
In the state, it's a big percentage. It's about, should say, like 10% of children.
And I understand that some people, just even touching it causes a response.
Yeah, exactly.
And they learn to stay away from that.
Yes, the smell, a small amount, depending on how sensitive you are. You can be mildly sensitive or you can be very sensitive. The thing is, it's not that common that food allergy trigger asthma. It's more environmental than, but people can start feeling the tightness in the throat and the cough and the difficulty breathing, not necessarily being an asthma exacerbation. It's more a different kind of reaction. But with the environment, definitely there is.
If I was to have a glass of milk, I'd be in bad shape pretty rapidly. When I used to go out to eat a lot, I wasn't paying attention too much what I'd eat, and I would eat it, and 10 minutes later, my throat's swelling up, and my wife says, "So what did you have?" I said, "There must have been cream in that."
The thing, what happens with the milk is the whole milk, the fat of the milk can increase the production of mucus, and you can start having a lot of mucus in your throat and in your lungs.
So it took me 50 years to figure that out. but we have a plan.
I can tell you in 5 seconds.
So let's talk again about how a asthma patient, somebody that's been diagnosed, they go into your office and you say, listen, you have asthma. Here are the 5 tests we did. Yes, you have asthma, and this is the particular type that we think that you have.
Yeah.
Typically, excuse me, what sort of treatments do they get, and how long until they get a more, I don't want to say permanent resolution, but until they start feeling better?
Well, if you are compliant, in a couple of weeks, you start noticing the big difference.
Do what the doctor says, all right?
Yes, the problem is it happens with any chronic disease. You get used to that, and all of a sudden you say, I feel okay, and you stop taking the medication. With asthma, it's chronic. You need to be consistent, and you need to continue taking the medication even though you feel okay, because there is what is called asthma action plan. That's where we discuss with parents and we discuss with adults that you have to start with a medication that decreases inflammation. And usually that is corticosteroids, but you cannot take corticosteroid by mouth all the time because you're going to have a lot of side effects. So now we have the inhaled corticosteroids. The amount of steroid that is going into your blood when you are inhaling is like 10 times less that you have to take it by mouth. So it's going directly to the bronchi. It's going to start decreasing the inflammation. And it's a slow process because you have been getting inflammation over time and you are decreasing the inflammation over time. But if you are consistent with the corticosteroid, the inflammation will decrease and the asthma exacerbation or asthma attack will decrease. Then if the corticosteroid is not enough because your asthma is severe enough, there is another medication that is similar to the Albiro, that is a short-acting bronchodilator that is called long-acting bronchodilator. So when you combine both of them, you decrease the inflammation and you open up the airways and you are able to breathe better. And then there is a third medication that is called leukotriene. The most common one is called Montelukast, that act in a different area of the inflammation and help decrease inflammation. So you have multiple medications that you can use. If nothing works, we have a new generation of medication that has been going on in the past 20 years that are called biologics or monoclonal antibodies that are specific for different type of asthma.
Lots of children get asthma.
Mm-hmm.
In what age would you say that some of them start getting it?
Well, depending. If a child has an infection with the virus, the most common is called RSV at around, let's say, 4, 5, 6 months of age. After that, many of these kids continue having what is called bronchoconstriction and eventually can develop over asthma. Sometimes we put the word asthma so the parents understand, and not necessarily all of them will end up having asthma. Because remember, what is the definition? It's a chronic condition. So chronic means that at least you have to have these symptoms for a few months before you said, okay, this is asthma.
We know that we like to put names on things, names
Yes.
on the snakes, dogs,
Yes.
cats,
Yeah.
hurricanes, whatever, because there's a certain comfort
Yes.
in naming it, right?
Yeah.
We just feel a bit more relaxed. Is there a connection between arthritis and asthma?
Not that I know of. What happened is that people that sometimes have immunological problem and have what is called autoimmunity, they can develop arthritis, but it's not that the asthma causes.
Those things can be 100% independent of one
Yes.
another. So can we talk about COVID and the effect that it's obviously been pretty traumatic for
Yes.
the world? And certainly this is the first time I think that we've all been, as the Beatles said, we all live in a yellow submarine, for the first time, and we've all experienced, pretty much the similar things that have happened. Well, what sort of symptoms are you seeing? And I guess the word be long haul is people that had a COVID before, and how's that affecting their daily lives? And now that they're over the disease, but they're still left with some things.
What happened is, depending where the COVID affect you, yes, it's going to affect the breathing, and some people will end up in the hospital intubated. And of course, if you have to be intubated, your lungs will have inflammation, and that inflammation will last for a period of time. If you already had asthma, which is basic inflammation, and you have COVID, the inflammation is going to be worse. So so far, people that has been admitted to the hospital, it says that at least 80% of them has some kind of neurological problem. So it could be the headaches, it could be the decrease or completely lack of sense of smell or taste. There can be that they continue having dizziness, or they has loss of memory or fatigue. So there are some other symptoms outside of the respiratory symptoms that the COVID produced. But people that baseline had some respiratory disease like asthma, they can have more problems after the COVID, and that could be persistent for a long period of time.
It must have broken your heart when you looked at all those people that were on respirators.
Yes.
Oh my goodness. Must have been terrible.
It's a horrible situation. Besides, remember, with the COVID, you have to be completely isolated. You cannot have your family around you, which is an extra burden because it produces a lot of people that after leaving the hospital, they have a kind of PTSD, they have depression, they have some other mental issues because of the situation of being completely isolated.
And a friend of mine who she said, Michael, this is the disease of loneliness.
Yes.
And as he was going through this process, we were communicating by texting, and I'm thinking about it, I'm just getting emotional about it, that how alone he felt, right?
Yes.
And then he says, so now I'm wondering if I'm going to give it to my caregivers, right, at home. He wasn't sick enough to go in the hospital. And it certainly made him and me acutely aware of our healthcare process throughout the world and the country, how the connected and people with money got them first. I'm proud of Dade County, which went out of its way to make sure that everybody had access to that. But at the beginning, we saw all those stories, and most of them were all true, right? And we realized that it was broken. and disproportionately for poor African Americans, minorities, women, people that didn't have money to be able to gain access, and access to fair information
Yes.
about the disease and what it might mean. So here we are. This 1 month is this, almost June, all right, where everybody in the room has been vaccinated, and we look at it, and hopefully it looks like it, that for the most part, for us, at least here in Miami-Dade County, it looks like it's over for a while. Now,
not completely over.
Yes.
We still have a lot of cases, and we have to be aware that even if we are vaccinated, we have still the risk of getting the virus, even though most of the time it's going to be very mild. But if we get the virus, we are transmitting the virus. So we have to be still aware of that. It's not over, okay?
Thank you for pointing that out. My wife, who didn't leave the house for 7 months, I had last spring, it seems like, I had somebody come in and do my fingernails, my man pedicure. She locked me out of the house. She said, "You can't come in the house." And I said, "I understand, but I have a key." She said, "I locked it from the inside." Right? 2 days, right? And then that's when I began to realize that people respond differently to that stress.
Yes.
Even though every day I would take my clothes out the front door, clean my phone,
Yes.
jump in the pool and do all that, it wasn't enough for her. And so even now, as she's moving around, she's a little bit more comfortable with it. But we do need to understand there's a lot of this post-traumatic stress syndrome, which is happening, all right? And I know that May is Mental Health Awareness Month, and I know also, I think it is asthma.
It's asthma.
So there are lots of things.
Yeah.
All right? We know that stress can cause lots of problems. So what do you see in your practice from the stress of COVID that's causing physical symptoms?
Well, I can tell you that I had some patients that they thought that they were careful, and they were not careful enough, and they had a pre-existing condition, and they got the virus, and they had to be admitted to a hospital for 5 days in isolation, and they came out with a fear of everything. Even though they already got the virus, they were negative, wearing double mask, were staying home, trying not to be the things that they should have done before, but they are so scared of getting it again. They don't want to go back to the hospital. They don't want of the feeling of loneliness, of being completely isolated. And some of them has fatigue, and that fatigue make them more depressed because they cannot do the everyday things that they were doing before having the COVID. And that lasts quite a few weeks and sometimes like a few months. And that's a very depressing feeling.
And as we look back for the last 15 months or so, it's like when I say March, I'm not talking about the one here. I'm talking about the one back then.
Yes.
And as far as when it first came to town, one of the things I said, "Where's Rip Van Winkle? I just want to go to sleep and wake up and I'll have a beer." Then after I said, "No, I want to see how we do through this, how I respond to that." And over these 400 days, people would be checking with each other. People would say, "How you doing, Michael?" And I go, "I just want to know if bipolar is one word or two words, all right? Or it has a hyphen there because of this every day. Oh, it's getting better. No, it's getting worse. It's getting better." And here in our office, we wore masks, for the whole time, and we were open the whole time. We made people, wash their hands all the time. We cleaned. We did a lot of work. Nobody here got it, but it certainly changed how we look at each other. Is it safe to go near you? All right. Is it safe to give you a hug? And I know that sort of lingers. I think of all the little kids who can't express themselves, all right, and say, "Is it okay to go see grandma and grandpa and do all that stuff?" So I think that we're going to have a while where people are going to get readjusted to whatever the standard is going to be. We did have a get together at Casa Cuba restaurant recently. Mayor Cava was our speaker, and as we were putting it together, this is last week, I said, "I wonder how it's going to roll out. I wonder what people are going to do." We have 3 minutes left. And I said, just comply with CDC regulations. That's as close as I could get to it. And we see that there is a desire for people to get together.
Yes.
Understanding where we are with COVID, what's your best advice?
I think that we still have to be a little bit cautious, and eventually everything is going to be open. Everybody's going to be able to get together. I think that we have to learn how to take care of each other, because I think this should have been a very good lesson for all of us to realize that we are a society, and then we have to, I care for you, you care for me. And that has been something that has not been very good in our society. That, okay, I'm a young person, maybe I can get it, but I don't care because I'm not going to end up in hospital. But you have to realize that there are others around you, and you have to take care of the others.
A neighborhood gentleman came to me, and I said, "Is it important for you to get the shots?" He says, "Why?" He said, "Yes." I said, "Why?" And he said, "Well, because of my elderly mother." I said, "Did you get your shots yet?" He goes, "No." I go, "So what are you waiting for?" He couldn't tell me, but he has some aversion to it, whatever that is,
Well,
even though he knew intellectually.
Yeah, but the problem has, I'm sorry to say, but the media has done a very bad job about that.
Yeah.
Too many conspiracy theories instead of telling, and yes, we didn't know. The CDC has done the best that they could, but we didn't know what we were fighting.
Yes.
And that's just very difficult to give advice. And I think that at the very beginning, wearing masks, being separated, we tried to stay home and all that was important. And yes, there are problems about that, not only to have the infection, but to be isolated. People have been getting depressed and
Yes.
very bad. But on the other hand, we have to remember we have 600,000 people that died in a year.
Yes.
That's a huge
And
number.
there hasn't been too much coverage on that. I noticed the other day, all right, which was, it stopped, all right, that side of the coverage. We're going to wrap it up here, but one of the things I would like you to do, there's some young person out there, 17 to 20, that's wondering about their life and their future, and you're an accomplished person, an accomplished woman. I'd like you to talk to them as if they were sitting and you were giving them some suggestion or some advice, all right, about life. All right, which camera? Oh, this one right here. Which one? Oh, this one right there. Okay.
Okay, the main thing is that it's very important to think about the future, but it's very important to think about today, what we want, what we are, and to think about a society as in whoever, if I care for you and you care for me, we are going to be able to achieve better things than if we just care for ourselves.
Thank you very much for your
You're
words
very
of wisdom. Again, our guest today is Dr. Adriana Bonansea Frances from the Florida Center for Allergy and Asthma Care. Thank you very much, Doctor, for
You're
being
very
here.
welcome.
And thank you for taking care of all of us. Again, thanks for joining us. This is Live with Miami's Community News. I want to thank Howard and Tommy for doing the show today. Folks, have a great day.